do I think it's heading in the right direction? You'd have to say yes overall, but what do I see as potential issues? I think in orthopaedics, one of the things we really need to think about is whether we should be operating. I think there's a tendency to operate earlier in the natural history of some conditions, particularly osteoarthritis, than is absolutely necessary. I think we have to be careful that we don't get caught up and believe we can change the future too much in terms of an individual's knee in my practice. I always think of, can I improve this patient's situation as they are now, rather than do I have the ability to change what their knee is going to be like 10, 20 years down the line. I think whilst it's good to be aware of what might change the long-term outcome, I think one has to be wary about believing that one really can. I think surgery still is broadly about treating the condition that patient faces at the moment. I'm concerned about the role of technology. I think if you look at artificial intelligence, metadata, that sort of stuff, it certainly will be quite possible to diagnose a patient's condition without any involvement on the part of the surgeon. And I think robotics will gradually develop to where a procedure can be done well and reproducibly with less input from the surgeon. But I think the big decision is the step in the middle, which is when to operate. And I think that's both sort of got a basis in fact and science, if you like, but also there's an art to it and understanding a patient, and it's the personal side of medicine. And I do worry a little bit that potentially is being lost or can be lost. For me, I've had to think about things for various reasons in the last 5 years, and I've realised just how much I enjoy treating patients, but it's both parts of the treatment. It's the chatting to the patient in the consulting room, making the decisions, and then the surgical side of things. I still enjoy the surgery, but it's good. It's really enjoyable and good fun to chat with patients, but also allows you to get to know them, which will help you make a better decision about whether to intervene surgically or not. I worry a little bit that people are getting more concerned about money and the material rewards of surgery. I think that maybe that's just getting older and becoming a bit of a grumpy old man, but if I look at my mentors, they were always modest in what they charged patients. And I've always sort of taken that view as well, and was given a very good piece of advice from John Bartlett. And he said, you don't often treat someone who's earning more than you do. And I think that's a good thing to keep in perspective. And I'll often look at my fees in terms of the patient's annual income and go, am I really worth that to them? I mean, once you become recognised in the field, you can sort of charge whatever you want to a degree, and some people would see higher charging surgeons as being better just because of that. But I do think that it's important to just keep your role in life in perspective, and if you're doing medicine or surgery just for the money, then you're probably not doing it for the right reasons. I still see surgery as a vocation primarily, and I guess that's why I still enjoy what I'm doing. I think work-life balance is one of the things that everyone wrestles with in life, and surgery probably more so than many other areas. And there's a lot of discussion about that balance and not working ridiculous hours, trying to find time for one's family, trying to find time for pursuits outside the surgical world. And as one gets closer to retirement, I think you have more reason to think about that, because a lot of surgeons really are defined by what they do. That's their persona is really wrapped up in being a surgeon. So I know of people who've really struggled with retirement because there wasn't a lot to do afterwards, and it took them a while to adjust. And so I think it's good to try to achieve that balance, but at the same time, surgery is demanding, and you have to also make a choice about where you want to get to in surgery. Not necessarily by being super ambitious, but just what sort of things interest you. Are you interested in an academic component to your career? Are you interested in an international component to your career? Or are you happy just providing the service, but then you want to be able to provide a good service? And I think surgery is an area or a vocation that's hard to do part-time, is probably how I'd summarise it. There can be periods of greater or lesser involvement in it, but it's very difficult to be really good at what you do without putting in the time. A couple of other things that I just jotted down as notes that I think are worth passing on in terms of, are we heading in the right direction? I think behaviour of surgeons has been an issue over the years, and I think there's been definite improvements, and the answer would be yes, we are heading in the right direction. I mean, surgery can be a very stressful job at times, and the surgeon really sets the tone of the operating room, and it's their responsibility to keep the mood and the tone and the sort of energy of that room at a level that is conducive to getting the best outcome for the patient. And I think one learns that there's no value in getting the people working with you and around you stressed. They won't work any better because they're stressed. Sometimes a little bit of background pressure doesn't hurt to keep people on their toes, but actually making them stressed while you're operating doesn't help you do the operation any better. And I think it's really important just in general to remember to be kind and gentle in dealing with not only your patients, but also the staff who really are there to achieve the same end. I think as a surgeon, I'm always very heavily influenced by my last poor outcome, and I think that never changes. I think the further you get in surgery, in some ways, the more paranoid you become about when your next complication is going to happen, because it will happen. And I think you're just so much more aware of the ramifications of complications, and also aware that they come out of the blue. You can't predict when you're going to have a complication. So it's hard to pick out a single case, but if I think of the last complication I had, it's very clear in my mind. It was a fellow who had a revision total knee replacement, and unfortunately his patellar tendon avulsed, and that led to further surgery, which got infected, and then he had a two-stage revision prosthesis. And I think back of, what could I have done differently to have prevented that from happening? And so that has already continues to influence me when I'm in a similar situation. And I think it's being aware of those last poor outcomes that's so important in improving yourself as a surgeon. And you forget about the good outcomes, and often say to patients, when it's a brief consultation, I say, the better you're doing, the briefer the consultation in follow-up. But I think the other thing that came to mind when high-profile people, particularly sportsmen, and I can vividly remember the first time I did an arthroscopy on a high-profile footballer, And it was just a lot more tension and thinking, come on, just relax and just do it like you normally do it. And it's the same knee inside, and you need to address the pathology like you would for anyone else. But that heightened awareness is good. It's a bit of a rush, but also you have to learn to control it. And I think that's an important sort of skill if you are going to be in an area and in a practice that does treat people where their outcomes can be quite public, and learning to sort of mature and just sort of focus on what you're doing, I think is important. It also teaches you to, treat every person the same way. And also at the operating table, you've isolated, in my case, usually down to a knee, and it's a knee, and you're going to go through the same processes. And it sounds a little bit like a football coach, stick to the processes and you'll get the right outcome. But I think you do need to just stick to what you normally do and hopefully do well. If I had to nominate one person, it would be John Bartlett. I always regard John as my mentor and refer to him as my mentor. I met John in my final year of orthopaedic training, and I think we just hit it off right from the start. And it was really John who inspired me to get into knee surgery. Prior to that, I'd been thinking of either being an arthroplasty surgeon or before that a spinal surgeon. But it was John who introduced me to the knee and really got my interest going in that area. But I also had an international mentor, if you like, and that was John Fagan, who was introduced to me by John Bartlett. And I think John Fagan, even though it was from a distance, did play a significant part in sort of where I went in my career and opened opportunities for me. But John continued to be a mentor, and still is in many ways. I still chat with him about various issues, and different issues come up at different times of your career. And one of the things I think a lot about now is trying to pass on information and pass on experience. And I chat to John about how one can do that sort of thing. So he's had an ongoing role. John Fagan unfortunately passed away not so long ago. And then I think back further again, even through my sort of pre-orthopaedic years, I had some really important people at the Alfred, my first registrar, Neil McMullen, and then people like Bruce Davis, who was a cardiothoracic surgeon. Little things like teaching me how to use a needle holder with both hands and not putting fingers in the actual rings of the needle holder. We used to wear white coats then, and he said, you need to get yourself a needle holder and leave it in your pocket, and whenever you're just not doing a ward round, have it in one or other pocket, and constantly be opening and closing the needle holder without putting your fingers in the rings. So there's all sorts of little things that come into it over the years, and I always feel a bit guilty in some ways highlighting one person, although John clearly is my major mentor, but at the same time giving recognition to all the other people who had a very significant influence in my career. I'd probably just add one more, and that's Eric Glasgow, who was my anatomy professor at Monash, long passed away. But Eric looked out for me, I think, right from the very start. We met when I was a first year student, and we became friends and developed a very close friendship in the end. But he was always following where I was going in medicine and life, and I think from a completely different perspective was very influential, and that was a unique sort of mentorship, really. I felt very privileged to have it. So I've always been interested in participating in sport, not particularly well at any specific sport, but I've always liked to stay fit and be active, and that's changed over the years in terms of what I'm capable of, what I'm interested in. But I've had a long-standing involvement in surf lifesaving, going back to when I was 14, and in fact had to lie about my age because you couldn't get the bronze until you were 15. But even now I'm still patrolling down at Gunnamatta, and in a patrol with a whole lot of old guys. We're the megasaurs, but between us, I've worked out last year, I think between four of us, there was almost 200 summers of patrolling down at Gunnamatta, which is can be a treacherous beach. So that's something I still do. I really enjoy the mateship and the camaraderie, and it's just completely outside medicine. No other medical people there. It's just a different world, and I love that. I've always loved the skiing, and that's a passion I've always had, and it's been a great family activity. It's a really good sort of family sport because you're in one spot and you're living in a smaller environment, and I still enjoy that just as much as I ever did. And more recently I took up rowing, and that's been a great sport for me to find. I've found that there's a whole lot of things about rowing that I like. It's a lot of technical detail, it's a physically demanding sport, and through that I've met some really good people, and it sort of refreshed my interest at a time, or interest in life at an important time. I had a kidney transplant about 5.5 years ago, and funnily enough took up rowing just before that. But I met some great people who've become really close friends, and it really served as an important distraction through a difficult part of my life. One of my favourite books would be Birdsong by Sebastian Faulk, about the First World War and in the trenches, and beautifully written, very evocative sort of book. And I have some German background, and All Quiet on the Western Front is another book that has always moved me. I think it's a short book, it's a simple book, but profound in the way it sort of just puts into perspective the follies of war, really. And that's when, at the time of this interview, that's relevant. I mean, here we have Russia invading the Ukraine, and seeing terrible things happen, and you wonder what the way out of it actually is. And at a more local level, Jasper Jones by Craig Silvey is another book that I really liked. I thought that is an Australian classic, and it's a book I can easily go back to. And then if I think back to sort of earlier years and school years, Call of the Wild by Jack London was a book that's always appealed to me, as has Man Shy, Frank Dalby Davidson. Just books from an animal's perspective, really. So a variety of books, but books is probably the thing that would be my most favourite, rather than movies as such.